Ready?
Gotta do.
Aye. No. Good? All right. Welcome, everybody, to the Administrative Services Committee meeting. It's September 16th, 2024. We are at 5:07 PM, so 7 minutes late. So I apologize if anybody's been waiting for 7 minutes, but here we go. First item is to approve the minutes from the August meeting.
Make a motion to approve the minutes.
Motion, second?
I'll second that.
Second, all in favor, say aye.
Aye.
Opposed? Carried. Brings us to the privilege of the floor. Is there anyone here that would like to speak to us about anything on our agenda tonight? Seeing no one, we will close the privilege of the floor. Brings up our first item, a tabled resolution reallocating the salary grade for case manager health.
Hello.
Hello.
Good evening. I'm Lacey Wilson, Public Health Director. Here on behalf of the submitted resolution to reallocate case manager health from a grade 12 to a grade 14. This is something that we'd ask that you do in regards to getting our case manager health position, which is very similar in work and scope and task to a number of the other kind of case manager, caseworker positions throughout the county. And just moving them up in pay grade, that is something more sufficient with the type of sensitive and rigorous work that they do. This is something that Dr. Falk and myself looked at as part of our overall strategic planning for the department, specifically around our staffing plans. And this is what we felt was a priority area, but of course in conjunction with some other planning and staffing planning that we're doing long-term. But this was one that we felt was a pretty obvious need and upgrade. These case managers are specifically in our early intervention program. So they are dealing with and working with families and helping them to maneuver through some very difficult and sensitive aspects of their life. Most of the referrals that come to the program, or very many of them, come through CPS. So we're working hand in hand with the families who are experiencing what, children coming through the CPS program unfortunately have to experience. So this is very difficult and sensitive work. And is something that we felt was very justified and needed, specifically in regards to a very heavy caseload that they have been managing at this point. And like I said, this is in conjunction with some other staffing plans that we'll have in order to ensure that they can do their work well and ultimately serve the children and families of our county in a very excellent and professional way.
Okay.
So how many case managers are there?
5 case managers?
And are they're, it doesn't sound like they're nurses necessarily, right?
No, they are not all nurses.
And they're, are they working, are they doing referral? Are
They do, so service coordination is a major part of what they're doing, receiving referrals, and yes, they're also making referrals throughout the county, specifically around PT, OT, speech pathology. And so really, CPS, if you think of CPS, which you all are probably very familiar with, they go in kind of a short-term traumatic situation. They help stabilize a situation. We often receive those referrals, and then it's our staff who's working with those families long-term to ensure that services are in place long-term and in a sustainable way so that these children have better outcomes long-term.
So are they kids that are not necessarily early intervention kids that don't necessarily meet special education criteria? They just meet some other kind of criteria?
There's specific state criteria for this. So this is a state mandated
It's more
program.
of a high risk.
It's a high risk,
I'm
yeah.
just wondering if it's similar to the program that was in place where they were trying to give early interventions services to more people than would normally, or more children than would normally qualify based on, say, high-risk social and
So I'm looking at, I have Wendy Douglas and Denise Nichols who are here, who actually supervise and direct the program. So I was looking to them if they're aware of maybe the difference in the programming, but not that I'm aware of. Is it the same?
I guess I'm thinking, well, just to be completely candid, there was an early intervention program that was partly through Strong Starts, and that was discarded, and then now my
okay.
understanding is,
So I think
This-
you're probably talking about the NAS diagnosis? Is that what you're talking about? So these are referrals. So yes, our early intervention program has been tasked by New York State to pick up the referrals that would have gone through the Strong Start system.
okay,
So any child who is diagnosed with the neonatal abstinence syndrome is an automatic qualifier for our early intervention program now, which is part of the reason why the caseloads have increased quite a bit over the last 8 months, really, what we've seen. And then in conjunction with the backlog from COVID, these assessments typically have to be done in person. And so we weren't able to do those assessments during COVID, obviously. So now there is an additional influx since COVID to the program. But yeah, so the early intervention service is really a state mandated program. It has to be facilitated in each county. The public health department is considered the safety net provider of that service. So we are the office that provides specifically early intervention. And if I'm right, it's 0 to 3. So ages 0 to 3, and that's where that NAS diagnosis has come in now.
okay, yeah, I mean, because I know early intervention has been in place for years.
Years and years, yeah.
But this, is it any different than it was before? You're having more cases than before, yeah, okay.
So a combination of lack of assessment and diagnosis during COVID, a lot of kids were not assessed, didn't see their physician. So, and we also have in this county a huge number of children that are born with substances in their system. It has not gotten any better.
Mhm.
So we do get those as an NDS, but then any child that, we have to go into each and every home based on, it could be a parent referral, physician referral, a daycare referral, then we would pull in an assessment scheme based on what we see to decide what the child needs. 'Cause the idea of 0 to 3 is within the home.
Yeah.
I mean, Denise has done some really out of the box thinking by trying to do like drum circles to get OTPT in a library and stuff like that, because we don't have enough providers to go around either.
Doing more.
More group setting, yeah.
Oh,
The
that's neat.
state recommends a caseload between 30 to 50. Our girls have been functioning closer to 70 to 100.
Oh, okay, thank you.
Only because it has to be asked or should be asked, what's the impact on the budget?
On the budget.
Yeah.
So again, as part of our proactive strategic planning, this is something that we've included in the 2025 budget that you'll hear about in the coming weeks. This increase would, based on an assessment done by the fiscal team, impact about $28,000 for the entirety of the year.
And is some of that reimbursed because it's required by state, or is it? Yeah.
Yes.
What's the
Mhm.
percentage, do you know?
Well, there's a whole algorithm based on a base rate pay that we get, but then basically it's 36%. After that is our state aid reimbursable, but through early intervention and preschool, there's actually grant programs and things that are provided. So the state provides kind of lump sum grants for these programs. And that's evaluated year to year based on the caseload that you had the year prior.
Just real quick on the figure there, just wanted you to know that includes the fringe costs as well. It's not just the wages, it's the wages plus FICA,
Thank you.
Medicare, and retirement.
Total,
Okay.
okay,
Yeah.
good.
Thank you. That's a
So-
good point.
It includes the.
It does,
Okay.
yeah.
It's less than I thought it was gonna be, so.
That's what we hoped for too,
Yeah.
yeah. And it's a very worthy return on the
Yeah,
investment. for
I
us.
just, you gotta ask.
I
I hate to ask
It's your job, I
budget
can,
during this, but,
yes.
yeah.
It's a
We
great
certainly
investment
Yeah.
for the future, right?
Yeah.
In terms of services at the far end.
Yeah. And I should say too, this is something that Wendy and Denise and their staff have been a wonderful partner in this conversation with HR and our department too. This is something that we feel like we not only can support the wonderful staff that, you know, they're working with, but will directly impact the community. So for us, it was something that, of course, we wanted to support, you know, support this moving forward for them. And it's just been a good and positive partnership with the management team and the staff. So that's something I should highlight.
No, they didn't.
Anything else? If not, all in favor say aye.
Mr. Chairman,
Yeah, oh, yes.
this was a tabled resolution
Oh, yeah.
We have to-
in your committee, so you need to make a motion to take it off the table
Oh,
before you act on it.
all right.
I'll second it. I'll second this.
Motion to take it off the table. Second. All in favor of bringing the tabled resolution off the table?
Aye.
Opposed? Carried? All in favor of the tabled resolution that's been taken off the table that we've just discussed?
Aye.
In favor, say aye.
Aye.
Did you have the motion, one up?
What's that?
Did you have your motions already? I didn't see,
Yeah.
I didn't hear them.
Yeah, what were you doing?
I guess, getting distracted with you.
Mr. Chairman.
Mr. Chairman.
Yes, Susan made the motion and Lisa seconded it and we voted on it, and yes. Is that what you're asking?
Yes. Carried so ordered.
Okay, thank you very much. Next proposed resolution, amend the ITS budget communication system for upgrade project. Please state your name.
My name is John D'Angelo, Chief Information Officer for the county. So this resolution is requesting an additional $70,000 for our communications budget. We had the opportunity this year to act on a project to upgrade our 3 communication servers. We have one in Mayville, one in Dunkirk, one in Jamestown, along with the resources from the vendor who helps us. So we really got a really good deal, so I felt like we had to jump on it this year. So we've began the implementation of that, almost finished with it actually, and so, but we are gonna run short on the budget because we had to pay for this year. It will enable me to reduce the budget next year, as you'll see in the coming weeks, so it'll help us in the long term. So I felt it was prudent to jump on a good deal now. The servers are 8 and 10 years old, so they were due for replacement anyway. So, and as we do with communications, we bill back what we charge. So from a revenue standpoint, there's adjustments there as well. Some of our revenue is from the other departments, and some is from outside sources like CRIC and the New York State courts and things like that. So that'll offset some of our expenses as well.
Sounds pretty good. Any questions? And like, equipment like a server,
Mm-hmm.
so you're replacing one that's 10 years old. So the new ones that we're putting in, the life is,
We expect another at least 6 to 8 years,
Okay.
at least.
So
And at
they're-
that point, we'll probably go to the cloud for our communications by then, so.
This isn't the total, right? Or is this the total?
That's the total for the project.
Okay.
So that's kind of what we estimate that we'll overrun, so. Hopefully it'll be less, but I wanted to make sure we had enough in the budget, so I didn't have to come back a second time.
I can't wait to hear about the reduction. That's,
Yeah, it'll be, it's in the,
can you give us a sneak peek? No, I'm just,
not today.
Not today.
all right.
Thank you.
All in favor, say aye.
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 Opposed? Carry.
Thank you.
Thank you.
Thanks.
Okay. Okay.
Our next proposed resolution, amend the spending plan and 2024 budget for Chautauqua County projects funded by the American Rescue Plan Act, also known as ARPA.
Hello, Blake Ehrig, Director of Administrative Services. The resolution before you states that these 12 ARPA projects are completed and can be closed, returning approximately $1,800 back to the ARPA pool.
They're all the 43 from the original.
No, not all of them original 43, no, that's the various projects.
And I'm sorry, you said returning how much back?
1880.
1880.
Yes, 1,880.
Perfect, thank you.
Drop in the bucket, but
Yep.
we're dwindling down, so.
This all,
It's hard to say exactly, but we'll know more coming up next meeting, because I heard this. Yes, yeah.
so this is the year, right?
This is the year that every project needs to be obligated, or at least the
Obligated.
funds need to be obligated, and then we have until September of 2026 to spend it down.
Oh, boy.
Yeah, yes,
Get to say ARPA a few more times.
exactly, yeah, yeah.
All right. Appreciate all the work here. All in favor, say aye.
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 Opposed? Carried.
All
Thank you,
right,
Blake.
thank you.
And that is everything on the agenda, unless somebody has something for other. Hearing no other others. Motion to adjourn. We have a motion. Do we have a second? I
Second
hear
it.
that second. All in favor, say aye.
All right.
Opposed? Carried. Adjourned. Thank you, everybody.
Thank you, Mr. Chairman.
What time did you start, Bob? 5:08?
5:07.
5:08.
Oh, man, that's how you run a committee.
That's how you do it.